This video is all about the 5 steps to identifying a tooth and acing your tooth identification exams in dental school. If you've been struggling on your tooth identification exams because you can't figure out the answer, you're running out of time, or you're getting anxious and doubting yourself, it's time to start using a strategy. I'm sharing the 5-step strategy I used in dental school that ended up getting me 100% on the last tooth identification test. But before I do, be sure to go to the link in the description and download my newly updated free 5-step tooth identification cheat sheet that is going to have visuals and charts to give you clarity around each step. Be sure to download the 5-step tooth identification cheat sheet in the description below so you can follow along and reference later. So the 5 steps to identifying a tooth. When you're taking a tooth identification test, you know the answer is one of 32 permanent teeth. The goal is to narrow that down so that you find the correct answer. So one step at a time, we're going to get you down to one type of tooth and which half of the mouth it's in. And it's going to be done through a series of 5 steps or questions to help you narrow down your options to the correct answer. And those steps are: step 1, what class of tooth is it? Step 2, is it a maxillary or mandibular tooth? Step 3, which type of tooth is it? Step 4, which side is which, aka which side of this tooth is mesial versus distal, and which side of this tooth is facial versus lingual. Step 5, is this a right or left tooth? As you answer these questions, you'll get closer and closer to the correct answer, almost like you're following a path to the correct answer. Almost as if you're following this little decision tree. You'll take your tooth, you'll ask question 1, what class of tooth? Step 2, maxillary mandibular. Step 3, what type of tooth? And step 4 and 5 helps you figure out if it's right versus left. One of 32 teeth. The first step to identify a tooth and ace your tooth identification exams is, what class of tooth is it? Is it an incisor, canine, premolar, and molar? To figure this out, you're going to look at the number of cusps. If the tooth has no cusps and a flat biting edge, aka has an incisal ridge, it's an incisor. If the tooth has 1 cusp, it's a canine. If the tooth has 2 or 3 cusps, it's a premolar. And if the tooth has 4 or more cusps, it's a molar. Now, don't let the canines trick you. Bonus tip, don't get tricked into thinking the maxillary canine is a premolar. Sometimes that cinculum is very prominent. Don't confuse that with the second cusp. If it's in that cervical 1/3 and there are no pits or grooves in the fossa, it's a canine, not a premolar. 1 cusp, canine, 2 cusps with grooves, premolar. Bonus tip number 2 for the canines, don't get tricked into thinking the mandibular canine is an incisor. Sometimes that mesial cusp ridge is very close to horizontal and it might trick you into thinking it's an incisal ridge. It's not. You can tell that this is a canine and not an incisor with a few things. 1, there's a cusp. Even if that cusp is off-centered and sometimes worn down, you can tell it's a canine instead of an incisor because that mesial outline is very straight. The outline of the crown matches with the outline of the root and it's very straight. There's no curving to that. And finally, there's a distal bulge on a canine, not an incisor. Don't mix the canines up with premolars and incisors. The second step to identifying a tooth is determining, is it a maxillary or mandibular tooth? For the incisors, this is going to be based on the size and shape of the crowns and roots. Maxillary incisors have larger crowns, more square crowns, and the roots are more conical. The angles of the crown are also more rounded. Mandibular incisors are smaller, crowns are more narrow, tooth in general is more narrow, and they have more sharp, straight lines to the crowns compared to the maxillary incisors. The roots are also very narrow mesial distally compared to facial lingually, giving them a ribbon-like shape, rather than the cone shape that we saw in the maxillary incisors. For determining if it's a maxillary mandibular tooth for the canines, you're going to look at the features of the crown. The maxillary canine has more prominent features, so a more prominent cingulum, more prominent lingual fossa, more prominent distal bulge, and more prominent ridges. While the mandibular canine has less prominent features. Things tend to be flatter, less prominent cingulum, shallower fossa, less prominent distal bulge, and less prominent ridges. For the premolars, to determine maxillary versus mandibular, you're going to look for a tilt to the crown. If you look at a premolar from the proximal, you'll see for the maxillary premolars, the cusps are centered over the root. There is no tilting to the crown. For the mandibular premolars, the cusps are tilted lingually. There's a tilt to the crown. Cusps are not centered over the root. They're tilted lingually. For molars, to determine if it's a maxillary or mandibular molar, you're going to look at the number of roots. Maxillary molars have 3 roots. Mandibular molars have 2 roots. The third step to identify a tooth and ace your tooth identifications exams is to ask yourself the question, what type of tooth is this? For maxillary incisors, is it a central or lateral incisor? You're going to look at the crown shape for this. The crown of a maxillary central incisor is more square with a straighter outline and sharper angles compared to the crown of the maxillary lateral incisor, which is more rounded overall. For the mandibular incisors, the different types are a central versus lateral incisor. For the mandibular incisors, you're going to look at these teeth from the incisal. You're going to hold the tooth so that the incisal ridge is horizontal to your eye level and look at the cingulum. If the cingulum is centered, it's a mandibular central incisor. If the cingulum is displaced to the side or twisted to one of the sides, it is the mandibular lateral incisor. For the maxillary premolars, there are 2 types, the maxillary first premolar and the maxillary second premolar. To tell these apart, you're going to look at the occlusal grooves. They're different. For the maxillary first premolar, there's a groove down the center that's split into 2 on the mesial and distal, making 2 sideways peace signs. There's also a groove that's going to cross over the mesial marginal ridge. This is the mesial marginal developmental groove. While the grooves of the maxillary second premolar are more numerous, more random, look raisin-like, and there isn't that groove crossing over the mesial marginal ridge. For the mandibular premolars, there are 2 types, the first and second. To tell these apart, you're going to look at the occlusal anatomy. The mandibular first premolar has 2 prominent pits that look like snake eyes, while the mandibular second premolar is going to have grooves, less prominent fossa and pits, and those grooves are going to make a few different shapes. In the mandibular second premolar 2 cusp form, the grooves will make an H or U shape. In the mandibular second premolar 3 cusp form, it's going to make a Y shape. 2 prominent pits, snake eyes, mandibular first premolar. Not as prominent pits, grooves with a few different options of groove patterns, mandibular second premolar. For the maxillary molars, there are 3 types, the first, second, and third. To tell these apart, you're going to look at a few things, the roots and the occlusal anatomy and cusps. For the maxillary first molar, there's a very prominent distal lingual cusp, and there's going to be a cusp of Carabelli. The roots are going to be the most flared of these 3 types. The maxillary second molar is going to have a less prominent distal lingual cusp, no cusp of Carabelli, and less flared roots. The maxillary third molar is going to have a bulbous crown, converging roots, and inconsistent occlusal anatomy. The third molar might also have open apices because it hasn't fully developed and it was extracted probably in a teenager before the tooth was fully developed. So if you see open apices on a maxillary molar, you'll know it's the third molar. Mandibular molars, there are 3 types, the first, second, and third, and you'll tell these apart once again by looking at the occlusal anatomy and the roots. The mandibular first molar is going to have 5 cusps, the mandibular second molar is going to have 4 cusps, and the mandibular third molar is going to have lots of variety. Could have 4, 5, or 6 cusps, but that mandibular third molar is going to have a more bulbous crown, converging roots, and the apices might still be open. The fourth step to identifying a tooth is deciding which side is which. Specifically, we're going to need to know which side is the mesial and which side is the facial before we go on to step 5, which is deciding right versus left. So I've made a chart for each tooth that will show you how to tell mesial versus distal with a picture lined up at the midline, mesial in the center, distal on the outside, and I'll also show you how to determine which side of the tooth is facial. We're going to need this mesial and facial for the next step. For the maxillary central incisor, the distal outline and distal incisal angle are more curved than the mesial, so the straighter, sharper side is the mesial. Looking from the proximal, the side that is more convex, not concave, not the side with the fossa, is the facial. For maxillary lateral incisors, the distal outline, distal incisal angle are more curved than the mesial, so the side that's straighter you know is the mesial. Looking at the maxillary lateral incisor from the proximal, the side that is convex, not concave, not where the fossa is the facial. For the maxillary canine, there's a very prominent distal bulge, so the side that doesn't bulge as much, is not as convex, is the mesial. Looking at this tooth from the proximal, the side of the tooth that is more convex, not the side with the fossa, is the facial. For the maxillary first premolar, you're going to look at this tooth from the occlusal to determine mesial from distal. There is a mesial marginal developmental groove that's going to cross the mesial marginal ridge. So the side of the tooth that has a groove that goes from the occlusal to the proximal, that is the mesial. You could also look at the lingual cusp. The lingual cusp is mesial to the center. For the maxillary first premolar, looking at from the proximal, the cusp that is taller and larger is the facial side of that tooth. For the maxillary second premolar, the lingual cusp is mesial to the center, and that's how you'll determine the mesial. And once again, the maxillary second premolar, the taller, larger cusp is the facial. Moving on to the maxillary first molar, we're going to look at the occlusal anatomy. The distal lingual cusp is on the distal side of the tooth, and the cusp of Carabelli is on the mesial. You'll use those two landmarks to determine that this side is the mesial. The maxillary first molar has 3 roots. The side with 2 roots is the facial. The maxillary second molar has a distal lingual cusp, which is significantly smaller than all the other cusps, and that will be on the distal. The maxillary second molar has 3 roots. The side with 2 roots is the facial. The maxillary third molar has a lot of variety in anatomy. It's going to be difficult to differentiate the mesial from the distal. I don't think your instructors will be testing you on this. If you identified a maxillary third molar, to be fair, I would bet they would let you put the right or the left. Moving on to the mandibular teeth. The mandibular central incisor has very symmetrical anatomy. You can't differentiate between mesial and distal. You're not going to be able to tell the difference between the left and the right. Once again, on a fair test, you won't have to determine left versus right for the mandibular central incisor. The mandibular lateral incisor, to determine mesial and distal, you're going to look from the incisal. You're going to hold that incisal ridge horizontal to your eye level, and you're going to look at the cingulum. The cingulum is going to be twisted or displaced to the distal. The side that the cingulum is not twisted towards is the mesial. Looking at the mandibular lateral incisor from the proximal, the side that's convex, not the side with the fossa, not the concave side, is the facial. For the mandibular canine, there's going to be a bulge to the distal and a very straight outline to the mesial. So the side of the crown that's very straight and in line with the root is the mesial. For the mandibular canine, looking from the proximal, the facial is going to be that convex side, not the concave, not the side with the fossa. It's the convex side is the facial. For the mandibular first premolar, look at the occlusal to determine mesial and distal. Looking at those 2 occlusal pits or snake eyes, there will be one pit that is a groove coming off of it towards the mesial lingual surface of the tooth. The side with that groove is the mesial side. The facial of the mandibular first premolar is the side that the crown is not tilting towards. So the crowns of the mandibular premolars tilt towards the lingual when you look at it from the proximal. So the side that it's tilting away from is the facial. For the mandibular second premolar, in the 2 cusp variation, you're going to look at the lingual cusp, and that lingual cusp is going to be mesial to the center. In the 3 cusp variation, look at the lingual cusps. The larger of the 2 is the mesial lingual cusp. So the larger lingual cusp is the mesial of the tooth. For the mandibular second premolar, the crown, looking at from the proximal, tilts towards the lingual. So the side that is not tilted towards is the facial. For the mandibular first molar, look at the cusps to determine mesial versus distal. The smallest cusp is the distal cusp, positioned on the distal side of the tooth. Other ways of determining mesial versus distal for the mandibular first molar is the crown tapers towards the distal. The mesial outline from the occlusal is straight, while the distal outline from the occlusal is convex. Additionally, the roots tilt distally. For the mandibular first molar, looking at from the proximal, the crown tilts towards the lingual. So the side that the crown is tilting away from is the facial. For the mandibular second molar, the crown is going to taper towards the distal. The mesial outline from the occlusal is straight, while the distal outline from the occlusal is convex, and the roots tilt distally. For the mandibular second molar, if you look at this tooth from the proximal, the crown is going to tilt towards the lingual, so the side that the crown is tilting away from is the facial. The mandibular third molar, just like the maxillary third molar, has lots of variety to the anatomy. It would be unfair to have to determine mesial versus distal for this tooth. It would also be unfair to determine right from left for this tooth, because these teeth can get pretty weird. The fifth and final step to identifying a tooth and acing your tooth identifications exams is to determine if this is a right or left tooth. You're going to do this by lining up the mesial side of the tooth that we determined in step 4 to the midline of an imaginary mouth with the facial side, which we determined in step 4, facing you. Wherever that tooth ends up in this imaginary face, as you line up the mesial with the midline, the patient's side that it ends up on is which side of the mouth that tooth comes from. Remember, this is the patient's left and right, not your left and right. As a quick bonus tip, instead of imagining a face in front of you, if you're given a scratch piece of paper for your test, draw or write out a chart of teeth. This way you don't have to use your imagination. You literally have a midline marked. You even have the numbers written down for a quick reference. So now you know the 5 steps to identifying a tooth and acing your tooth identification exams. Those steps are: step 1, what class of tooth is it? Step 2, is it a maxillary mandibular tooth? Step 3, what type of tooth is it? Step 4, which side is which? And step 5, is it a right tooth or a left tooth? Now let's work through those steps together, identifying 2 different teeth in these examples. All right, so what tooth is this? Let's first determine what class of tooth it is. This tooth has a very flat biting edge, no cusp, it's an incisor. Step 2, is it maxillary mandibular? For the incisors, the maxillary teeth have conical roots, larger crowns, while the mandibular incisors are very narrow mesial distally and have smaller crowns. This tooth that we're looking at here, conical root, large crown, it's a maxillary incisor. Step 3, what type of tooth is it? For the maxillary incisors, we're determining central versus lateral. The central incisor has a straighter outline and sharper angles compared to the more curved and more rounded lateral incisor. This tooth we're looking at, quite square, straight lines, sharp angles. This is a maxillary central incisor. Which side is which? Well, we can reference that chart. The mesial side of the tooth is going to be straighter than the more curved distal side of the tooth. So looking at this tooth, this side is straight compared to this more curved side. So I know that this side is the mesial. Which side is the facial? It's going to be the more convex side, not the side with the fossa. So this side is the facial. Is this a right or left tooth? The way I'm going to figure this out, I'm going to hold this tooth with the facial facing me, and I'm going to remember that this is the mesial. I'm going to take this tooth to my imaginary mouth or my scratch paper with the written out teeth numbers, hold the mesial to the midline. Which side of the patient's mouth do I end up on? The right side. So this is the maxillary right central incisor, aka number 8. Let's do another tooth, a posterior tooth this time. What tooth is this? Let's start by figuring out what class of tooth this is. I see multiple cusps here. In fact, I see 5 cusps. A tooth with 4 or more cusps is a molar. So this is a molar. Step 2, is it a maxillary or mandibular molar? For the molars, to determine maxillary versus mandibular, I just look at the number of roots. This tooth has 1, 2 roots. It is a mandibular molar. Step 3, what type of molar is this? Is it the first, second, or third? Well, looking at the occlusal anatomy of this tooth, I see 1, 2, 3, 4, 5 cusps, and the mandibular first molar has 5 cusps. This is the mandibular first molar. Which side is which? Let's determine which side is mesial. I'm going to look for that distal cusp, the smallest cusp. I'm also going to look at the occlusal outline. I see it tapering towards this side. I see it tapering towards the distal. The outline here is straight while this outline is curved. So this is the mesial, this is the distal. I remember mesial. For determining which side of this tooth is the facial, I look for that lingual tilt of the crown. It's tilting away from the facial. So this side of the tooth is the facial or buccal. Now that I have my mesial and my facial determined, I'm ready for step 5. Is this the right or left tooth? I'm going to hold this tooth with the facial facing me. I'm going to hold the mesial. I'm going to place this mesial at the midline of my imaginary mouth. Which side of this mouth have I ended up on? The patient's left. So this is the mandibular left first molar, aka number 19. And that's it for this video. Go in the description and download that cheat sheet if you haven't already. And then go ahead and check out this playlist where we go through a bunch of different teeth and identify them using these 5 steps. Happy studying. Bye.